Laparoscopy is a procedure where we use several small incisions. We have a TV camera that's on a small in a small tube that allows us to see inside of the abdomen without having to look directly with our eyes. We watch on a monitor in the OR. We fill the abdomen up with carbon dioxide while you're asleep, and we use several other small ports to introduce small thin instruments that allow us to grasp and manipulate and divide and sew bowel, or to for the lap band we can place the band in through one of those ports and then sew it into place without having to make a big incision. It's a great advantage in many people. It obviously allows for less pain after surgery. With a larger incision, you have more of a chance of this gristle of the abdominal wall not healing perfectly well, and that can cause a hernia later. You can get hernias in these small ports as well, but the chance is lower. Time in the hospital is shortened, and the chance of infection is a little bit lower also with laparoscopy. However, in patients who have extensive adhesions or unusual anatomy inside of their abdomen, what's most important between these two options is what is safest. And we do always try to do laparoscopy if we can. However, safety really is our ultimate goal. And people who have open procedures do very well also. One of the difference, one other similarity between the two is there's no difference in the weight loss, and very little difference beyond about 3 months in terms of the mobility, your ability to move or do activities. Like I mentioned here, open surgery may be safer for certain patients if they have tremendous number of adhesions, or if it's a reoperation. It certainly is a larger scar, and there is more of a risk of wound infection or hernia. The longer recovery time is only usually a couple of extra days in the hospital, and the pain difference is not tremendous. Obviously, they are both operations, and so you may be a little quicker to oral pain medications with laparoscopy, but you still have to take some. The advantages of laparoscopy really are just that it is less invasive and a little shorter hospital stay. It does take longer sometimes in the operating room. It depends on the surgeon and the surgeon's experience and their expertise, but it's certainly not ideal for everyone. And that is where we work together as a team and talk about these issues, and certainly also where at some point you do have to trust our judgment in the OR to do what is right for you if we go in and find something that's surprising. There's always a possibility of conversion to open with any procedure, whether it's gallbladder, appendix, hernia, or what have you. Now for the gastric bypass, the average hospital stay is somewhere between 1 and 7 days. Most people after laparoscopy will go home at 2 days or so, give or take a day. Most people after an open gastric bypass will go home somewhere between 3 and 5 days. Obviously, if you have a problem, if there's any other issue, if you have a complication that comes up, then you need to be in the hospital until that is resolved or improved to the point where you can safely go home. Everybody in our program, whether for a gastric bypass or a lap band, goes through a 2-week liquid diet. It's high protein, low calorie, to make your liver smaller. Some programs ask that people lose a certain number of pounds of weight. We have found that women have a harder time losing a certain number of pounds than men, but if everybody follows this diet, the real issue we're worried about is room inside of the abdomen rather than what the scales say. And that if people follow that 2-week diet well, that has generally proven to be really effective for us in getting the liver out of the way. And it does give a little more room otherwise also in the abdomen with some of the fat around other organs. You do need to be well hydrated. We don't want you to be sweating off pounds or anything like that. It's not a matter of the number of pounds. After surgery, you follow a 2-week liquid diet post-operatively as well to allow things to heal, and then we slowly advance food. It's hard to get enough fluid in for some people, and it does take work. You can't wait until 3 o'clock in the afternoon. You have to start in the morning with small amounts of fluid and keep it up all day. The activity limitations depend on what approach you had. If you had laparoscopy, we ask that you not do anything high impact for 2 to 4 weeks, and with an open incision, usually 3 to 6 weeks, usually towards the 6 weeks end for heavier activity. Going back to work really depends on what you do and how stressful that is physically. Certainly your energy is down for a good 6 to 12 weeks, but it does come back pretty quickly even after 2 or 3 weeks. And I'm more concerned generally about people wrecking their car on the way to or from work than I am about what happens at work, unless you operate heavy machinery. However, just be aware, 8 hours at a desk will still wipe you out if you try to go back a week after surgery. So generally, the sooner you go back, the shorter we want you to be at work, and perhaps even more, like every other day, if you're going back really early. You can definitely talk to your surgeon about that as well. For the lap band, people often go home the same day, or usually home the next day at the very least. People only stay 2 and 3 days if they're really having a major problem, and that's very rare. We do get an x-ray to just get a baseline to see where the band is in case you have a later complication. Usually the band will move a little bit if there's a problem. Everybody does the 2-week pre-op diet for liquids, again for liver size, and then post-operatively you're a little more liberal in terms of the types of liquids you can have because you don't have dumping with the band. But we do want people to be on a mechanical liquid diet just to let the band seat into place and heal. Healing is very important for both these operations, obviously. Activity limitations are a little bit more liberal. Certainly your body's still going to tell you what to do. It's very rare for somebody to go out and really, truly overdo it because your body sends you pretty good messages, unless you're not listening. Back to work is quicker as well. Post-operative issues for both procedures, obviously pain control is important, first of all for your comfort, but also so that you can get up out of bed and move when you're at home, so that you can take a deep breath, which you don't normally do as deeply if you have uncontrolled abdominal pain. Nausea is very common after both of these operations. Some feeling of nausea is common for even 6 months with gastric bypass, but certainly vomiting is not common, and we do give people anti-nausea medications after lap band to prevent them from retching. After a gastric bypass, if you're having true nausea that's uncontrollable, we want you in the ER, so we don't give people anti-nausea medications after gastric bypass, because if it's to such a point that you're really throwing everything up, we need to assess you. Walking is important. It doesn't mean for exercise. It's mainly just to prevent blood clots in your legs and to get your body up in an upright position so that your lungs work better. And that's about 3 minutes every 3 hours. You don't have to overdo it. More is not better for that. But you don't want to be just totally bedbound at home. The incentive spirometer is a little breathing coach machine, a little pipe that encourages you to take deep breaths so that you reduce the risk of pneumonia.